Medicare Advantage prescription drug plans versus Medicare supplement plans. There's a battle out there going on with information. And what I would encourage each person to do is make sure you have the accurate information in order to make the decision for yourself. A lot of that information actually comes from the zip code you live in. So if you go onto Medicare.gov or you speak to a local independent insurance agent who's appointed with multiple companies that has the software to compare these plans in your zip code, that's kind of the baseline, because there might only be a few MAPD plans in your zip code. There might not be any MAPD plans in your zip code, or there might be a lot of them in your zip code. So where you live and the plans that are available between the MAPDs and the Medicare supplements, which are standardized, so we know that a plan F is a plan F, and a plan G is a plan G, and a plan N is a plan N, that you want to compare what the MAPD, all the plans, including the prescription drug plan Part D that goes with your supplement. Then just decide based on your health expectations, your current health, what health issues you might have had in the past, and what you project in the future would really be the foundation of picking the plan, as well as getting into the costs on your prescription drugs. A lot of times people don't realize that some Medicare Advantage prescription drug plans have better formularies than the Part D plans, which means people will pay less money to fill their prescriptions. Taking all that into account is what we would recommend, and we're happy to do that with you. So feel free to reach out, and we will give you a call back or answer the phone.